Living well. Living well really is the aim of any of the human being in our life, starting from any child patient to any adult growing patients. So what we'll try to do in our program is to give you the medical information in a very light meal and in a very simple way and language. We'll try to discuss about diseases, the causes of the diseases, the symptom of any disease, and then we'll finish by trying to treat or suggest any treatment for those diseases. So the aim of Living Well is not only yours, it's also our aim in our program to give you a very light meal of medical information in a very simple language. So just bear with us in our program and we'll try to be a very, let's say, light guest in you every week. Hi there. Being aware of the, let's say, any medical emergency around you while driving or being in a mall or even spending a nice time with your family is very important. Having the knowledge of the first aid is one of the important things that during these times let's say the person or any educated person in the community needs to know. CPR, or what we call it the cardiopulmonary resuscitation, is very important to be known by some person during the daily life activity. What is CPR or what is first aid? CPR or first aid is the life-saving technique that usually performed in a critically, let's say, person in a very dangerous situation. For example, near drowning or a road traffic accident, sometimes patient with a sudden attack of shortness of breath or cessation of breathing. All of these what we call the cardiopulmonary resuscitation, or in the simple way language we'll call it the first aid. So before even performing CPR, we need to take care of some points that is very important in performing the CPR. For example, before even performing the CPR to the patient, which I will explain in a very, let's say, a simple way, we need to make sure that the environment around the patient is safe. The patient himself is in a safe, let's say, position or a safe place that is away from the fire or away from any dangers that might affect the patient himself. Another thing, we need to have an access to the emergency service, for example, the emergency service, or what we call the 911, for example, or here in Kuwait the number is different for the medical emergency. So these basic things need to be cared even before performing the CPR on that patient. Getting an access to a telephone with our mobile service, and we can call the emergency medical service, performing the CPR on the same spot and time, which is very safe, is really important to be considered even before starting the CPR. So by performing the CPR, our aim is to restore the circulation of the patient, and this is usually will be done by compression in a specific way and in a specific site, maintaining the airways opening, and then so it's CAP, for example, so the circulation, airways, and then finally the breathing or the airways breathing. So by maintaining those three things, it's very important to be performed during the early stage of the, let's say, loss of consciousness or drowning for the patient, or sometimes patient in distress or an acute situation. Chest compression is very important to be performed, but it needs a special technique. I really emphasize the thing that, you know, almost all the medical institutes in Kuwait, either the government or the private one, sometimes even, you know, the working institute, the ministries, usually they will do what we call it a course in CPR. The aim of those courses really is to teach ordinary people how to deal with those cases. So the first stage of the CPR is decompression. Usually we need to lie the patient down on his back and then performing the compression by the heel of the hand on those patients, using the power of the shoulder, not the power of the body, because most of the time if we use the power of the body, it will be very high, let's say, power, or too much power that is applied on the chest of the patients. Usually we will use the lower third of the the lower third of the chest by using the heel of the hand and then performing the pushing, let's say, technique or the compression technique for a certain time, and then alternating that one with the breathing. It's better to perform CPR with two persons, because if one person is tired, the other one can just simply perform the activity instead of the first one who's tired. So while performing the compression, we need to tilt the patient's face, or the patient, let's say, chin backward. Tilting the patient chin is to open the airways, and it's very important. Another thing is to use the mouth-to-mouth breathing technique, which is the technique used to push the air inside the lungs. So by performing this simple technique, and as I told you, it's any patient, let's say member of the community needs to join one of those CPR training course and to be trained on CPR. Nobody knows what will happen, but the important thing is to know how to act correctly on the time of the emergency.